Hello everyone. Today we have the honor of speaking with Farida, a breast cancer survivor who is going to highlight us about her course during the treatment and also speak about the importance of physiotherapy during her treatment. Thank you for joining us today, Farida.
Thank you, sir. Thank you for having me here. I would be glad to share my story with you.
Let's start from the beginning. Can you tell us about your initial diagnosis and the treatment which you underwent?
I was breastfeeding my daughter, was 11 months old, when I felt there is a small lump in my breast. Initially, I thought it must be some milk hardened or something related to breastfeeding. But after a week or so, when I was having my bath, I could feel there is something like a bony structure in my breast, which looked very different from anything else I have felt in my body. So even though my dad and my sister had undergone cancer earlier in 94 and 92, this was in 96. I still felt it may not be cancer because three members from the same family getting cancer is not a possibility. That is what I felt. But anyway, I went for checkup, and during the checkup and fine needle biopsy, I got to know that the cancer is in third stage, and the lump was just peanut size, something very small. But then the treatment course was decided that I should undergo first mastectomy or conservation of breast. But I decided I'll go for total radical mastectomy.
You were taught with some sort of physiotherapy exercises, not as a proper, not by a proper physiotherapist back in those days.
Yeah.
So, which exercise in particular do you think that it would have helped you the most in your phase of recovery? Any specific exercises which you think?
Because it's 28 years, this part I may not recollect very clearly, but I remember there was a lot of stress when I had to lift my hand. Like the hand had to come. He told me it has to touch this ear. Yes. That was very difficult to do. Yes. But on the 10th day, I could do it very easily. Immediately after surgery, it was very painful. But he told, no, you have to touch your hand has to come and touch your right ear. So this was one exercise he told me I have to do. Then combing the hair, which he told your hand has to move. There was constant movement in the hand. And since I had a 4-year-old and 11-month-old baby, carrying her or playing with them, that also kept my hand active. And I should say for 28 years, I haven't faced any particular problem other than some kind of a stiffness in shoulders I get sometimes. Yeah. And that also disappeared once I started wearing prosthesis. Because I think losing one breast and not having that part was that unevenness could have caused it. And after starting wearing prosthesis, even that has reduced a lot.